Hi, I'm going to show you a few photos of cases that I've done with composite bonding. I've tried to keep the examples quite varied so that hopefully you'll be able to recognise something in your own teeth that composite might be able to help with. So starting with using bonding to close some spaces. After a visit to the hygienist, closing the classic upper midline space. Here we decided to leave a little bit of space left over, as to close it completely would have made the tooth look too wide. Whereas on this one we took a little bit off the back of the tooth so that we could add more on the front of the tooth to close this space completely. Sometimes nature doesn't get it quite right, and composite's perfect for this. There's a few little tweaks here in colour, length and rotation. This lady didn't want to change her characteristics altogether, just to soften it and to mask the colour variation. This patient had an existing bridge on the upper left, and with composite we tried to get as much symmetry as possible. After some whitening we used composite here to close the space on the bottom and build out the upper tooth. Tooth wear comes in many forms that composite can help with. There are a couple of existing crowns here on the top right, and we use bonding to create a much better symmetry. I use composite veneers here to build out and add length to the upper central teeth. And here to restore the very heavy wear on the back of these teeth and add length. And finally a few cases where it's a bit more of a smile redesign. Here the front 4 teeth. And here the front 6 teeth. I don't think any of the results are perfect. I think that's just not possible without much more involved treatment. And if I had a magic wand, there's plenty of things I would change. But most importantly, it addressed the problem that concerned that particular patient and gave them the confidence to smile again.